not about my title. It's about what I can do to help somebody. And I get that that can be confusing from the public's perspective. And your wife is a great example. Like, oh, you're a chiropractor. This is what you do. But I think that's simply because we've only done it that way for the majority of our profession's existence. And I think that's a part of having these conversations like this, and what we're doing on our podcast and what we're doing for our platform is getting more chiropractors out into the world who are showing people that you can have a different experience working with a chiropractor. And that, yes, there are chiropractors that will only adjust you, and that's fine. But there's also chiropractors that can take you from this point where you have chronic pain and you don't know what to do and you kind of need a complete overhaul in the way that you're approaching it. They can walk you through that process and walk you all the way to the goals that you have.
Welcome to Build Beyond, a podcast designed to challenge and guide you on your health journey so that you can meet your full potential. My guest in this episode is Dr. David Newton. David is a chiropractor who practices in Broomfield, Colorado. In addition to being a doctor of chiropractic, David has a master's degree in sports and exercise science and is a certified strength and conditioning specialist through the NSCA. David co-founded Clinical Concepts, which is a mentorship program designed to help students and chiropractors gain confidence in evidence-based patient care. Additionally, David recently launched a new podcast called ChiroShift, with the goal of shifting the chiropractic status quo through engaging discussions with leading experts in the musculoskeletal healthcare space. His podcast is available on Spotify. During this episode, David and I discuss chiropractic maintenance care. Yeah. How have you been?
Oh, pretty good. How about you?
Good. I've been enjoying all the episodes you guys have been putting out.
Good. I'm glad to hear it. We're newbies in the podcast space, so if people are enjoying them and getting something out of it, we're pretty happy about it. So,
well, you're getting right into some stuff. You know what I mean? That your most recent one with Taylor, to kind of go back. I mean, if someone hadn't listened to your previous episodes, they may not have understood why people were upset. And I'll say, like, I've told you before, I support everything she said, although I wouldn't necessarily say it as boldly on a podcast as she did. But I thought you guys handled that really well with the kind of that rebuttal episode. It was interesting.
Yeah, I think it was something that needed to be addressed, and I think that's kind of a common theme for anyone coming into the space and making bold statements. I think there's always going to be pushback, and I think it really just provides an opportunity for those types of discussions to be brought forward and hopefully handled in a somewhat professional way. So I hope it came off that way, because it wasn't intended to make anyone feel bad. It was just an opportunity, I think, to have some of these open discussions. So,
well, I don't know her, but she just seems like she gets fired up and then she starts saying what's on her mind. And, I enjoy it. And it's one of those things I feel like we all get, like, everyone has a nerve that can get, irritated, for lack of a better term. So I feel like if someone's saying something and you're like, wow, that is really frustrating me, I really have this compulsion to respond. If you can take a minute and pause and be like, why does this bother me so much? Sometimes it's because, I'm wrong or maybe I'm not wrong, but they have a really good point. There's some truth to it. That's why it stings a little bit, because if someone was just like, well, they just say something totally outlandish and it's like, well, that's not even remotely true. It doesn't hurt that bad. But when there's some truth to it, I feel like that's when you get those spiteful comments or people get really upset. It's because deep down, it might be may not be 100% true, but there's something there that they don't want to confront. And that's probably why people get so upset about some of those things. But
yeah, and I think it's social media is a very dangerous place to engage in those conversations, at least in the comment sections, because you can't provide nuance. You can't really probably go into the detail that you'd like to. And I think people hear things in the way that they want to, not necessarily the way that they're intended. And if someone has an opposing view or opinion from you, you're probably not reading it necessarily 100% in the way that it's intended, simply because more emotion becomes involved. And I think when that happens, we know how that can shift the way that we see things. So
Yeah, it's hard. I think it's just a human experience, and I guess the internet gives people that little bit of courage because you can just type it instead of say it to someone's face.
yeah, and I'm glad she addressed that right off the bat. It's like, we are real people. We do read through comment sections, and I do think people think that they can say whatever they want. And I mean, I guess they can. Like, you do have the freedom to do that, but there always are people on the other end who are seeing these things. And I always wouldn't. I would never write anything that I wouldn't say to somebody's face. And I think a lot of people go far beyond that and write a lot of things that they wouldn't say to somebody's face, and it makes it an interesting space for sure.
I will be really interested if you get some of these keyboard warriors to come on your podcast, though.
The door's open.
I would love to hear. I would really love to hear that defense of that opposing opinion, because I think I would learn something. If not, even if it's not like, well, I'm going to change my mind, at least it helps me better understand when I'm talking to someone who has that different belief, where they're coming from.
Mm-hmm.
Because I do think a lot, I've never met an unethical chiropractor who's out there to like hurt someone or steal from someone. I'm sure they're out there, but I've never met one. Right. And so even though people have these beliefs that I don't believe in, I have to think that it is coming from a good place. So I think for me, that's the challenge of having those professional relationships where we couldn't be more polar opposites about the same topics, but finding that common ground, which is usually, is just you. I do believe that, subluxation based chiropractors do want the best for their patients. And so
Sure.
I feel like maybe if someone gets upset, I don't have enough listeners or viewers to get those comments, but if anyone's listening to this or watching this and anything I say upsets you, I honestly believe that you and I both care the same amount. So maybe we could find that as like the common ground and the starting point to at least disagree respectfully, because some of those comments that you guys got, I'm sure there was some worse ones that you didn't even read. It's kind of harsh, I don't know.
It is, and I think you know what you know. We all have our own biases, and that's completely okay. I just hate when, as professionals, we can't move beyond emotion to have a civil discussion. Again, as you just mentioned, like why do we have these differences, and what can we learn from one another? Because none of us know it all. I mean, you can't know it all. There's always something to be learned from these situations. And I'm not going to sit here and say that everything that I do is the best way, whatever that means. But I think the discussions just tend to become so uncivil far too often. And it's simply because we have a difference of opinion. But as you just mentioned, I think most of us truly care about our patients. So why can't we use that as a common ground to at least have the conversations and begin to attempt to hear what each other has to say? We don't have to agree. I don't have to change anybody's mind, but it's probably in my best interest as well to hear what other people have to say, because maybe I will learn something. So I wish more of us had that attitude, and maybe we do. Maybe internet's just a space where we put on a different hat and we act out of character, which I don't like that. But I think that's often the case. And, you see it all the time. People have pretty extreme discourse online, and then they meet in person and they're nothing but cordial to each other. Like, it's just this very weird dynamic that tends to occur.
When did you start to think differently about things? I mean, did you go into pick this profession because you had the views that you have right now, or was there some type of progressive change? How did that come about for you?
I mean, I think my entire schooling and career, there's probably been progressive change, but I didn't go into chiropractic knowing a lot about the philosophy and the history of the profession. I think what I knew of the profession at the beginning was very much that chiropractors worked with active people, with athletes. They were members of professional sports teams, healthcare staff. They are part of the Olympics healthcare staff, and that they were working with people at the highest levels in some capacity. From a detailed perspective, I don't think I necessarily knew what that meant, but I knew that they were contributing in one way or another to athletes at the highest levels. So from my perspective, it was, well, they must be doing something okay if they're working with some of the best athletes in the world. So maybe that's not a solid framework to begin to think about these things, but at least at the point in time, like that's what was going through my mind. As I was exposed to more of the philosophy and more of the history, I did have moments where I kind of questioned what I was doing. Luckily, I went to a school where the philosophy wasn't shoved down our throats. I wasn't really forced to read a lot of the history of the profession. We were exposed to some of it, but it wasn't taught as if that's what practice should be now. So I would say the school I went to probably claimed to be a little bit more evidence-based, but looking back, I don't know that we learned that much that contributed to evidence-based practice. Maybe evidence-based at the time was just a lack of philosophy. Maybe that was just a way to differentiate it. But as I became more and more exposed to these ideas, I think it was very easy for me to question them simply because my background has always very much been rooted in science. I think through undergrad, I took a lot of science courses. In high school and even younger, I think my brain was always more attuned to the math and science classes that I took. So I think that's the lens that I've always kind of looked at different things through. And when I began to apply that to chiropractic, it was very difficult for me to even begin to try and reconcile some of these ideas, like subluxation theory, into the research and the information that we have available to us now. I couldn't find a way to marry these two ideas in a way that really worked. So it's not that I don't doubt that spinal manipulation can be helpful and that there are areas of the spine that if we adjust those areas, maybe a patient in a particular setting has a better outcome. I think one of the examples that Rich used in one of our earlier episodes of our podcast was, if somebody has neck pain and you only adjust their SI joint, I don't know that they're going to necessarily walk away from that visit feeling a whole lot better. But we do have evidence that like adjusting the thoracic spine can help with cervical pain, right? So, but I think there's these ideas that as we go down these paths, there are a lot of things that we do very well as chiropractors, but I just can't get behind this idea that we shift the majority of our focus into a single idea, and that explains the outcomes that we tend to get. I just think it has to be more complex than that, simply because of the complexity of us as humans and the complexities of our own experiences. So to boil it down to a single idea and use that to explain everything thereafter, to me, that's almost a slap in the face of the human experience and an individual's pain experience. It goes so much further beyond that. It almost has to.
I was having this discussion with my wife last night and something like this, and she was like, so what you're saying is you don't really do chiropractic. And I was like, no. She was like, yeah, I know what you're going to tell me. She's like, I've heard this all before, but you have to understand that if you're going to say this to someone who doesn't have a lot of background in this area, if you say these things, they're just going to assume that you're a chiropractor who doesn't do chiropractic. So it's almost would be better to label yourself in another way to help them understand that you have more to offer, because as soon as you say I'm a chiropractor, there's this vision. There's already, they're going to make a judgment, good or bad, and they're going to think of someone who's going to adjust every patient and treat in a very specific way. And I thought that was an interesting perspective. My wife does marketing professionally, so she was thinking about like, and I was like, I can't just change my name, or it's a license thing, so it's not like I can go out there and claim to be something that I'm not. But I thought that was some good insight from someone who's not in the profession, who's just like adjacent to the profession of just being married to me. And so I don't know. I wonder if there is like a world in the future where, we change the label a little bit as like, some other type of provider that we provide chiropractic adjustments. It's a tool, but it's not something that defines us. And I don't know if we would need to change the name, but it might help. But obviously it's not within our control, but it's just an interesting thought, because I feel like I was talking to someone today about it, a student who's thinking about going to chiropractic school, and it's hard because it's like, what does chiropractic even mean? Like, what is it? It's hard to it's hard to define, and everyone's going to have a different definition. And even if you look at the American Chiropractic Association, their definition, that wouldn't really fall. The one they have published online might not even fall in line with what a lot of people who see chiropractic from a traditional point of view would think chiropractic is, because they don't mention subluxations, they don't mention clearing subluxations, they don't mention any of the philosophy. It's just really dealing with joint pain, specifically neck pain, back pain, and headaches related to neck pain, and then things with the extremities. But it's largely musculoskeletal, and they throw in some nervous system stuff in there. But I feel like it's a profession that I don't even know what our identity is, to be perfectly honest, because it's like we can't agree on it, which is a weird thing, especially when you're sitting, and you've done it more than I have, when someone's like, hey, I'm thinking about going into chiropractic, what do you think? And it's like, I mean, it can be what you make of it, but I don't know how to tell you what it is.
Yeah.
That's
a really good point. I think this is where probably one of the biggest debates within the profession tends to come up, is simply around that question, like, what is chiropractic? And I think the lens that we probably look at things through is very much that chiropractic is a profession that primarily deals with musculoskeletal issues. We have a wide scope. We have many things that are at our fingertips to address those issues. But to me, it's a profession that treats primarily a certain type of conditions. Like, I just like, to me, it's easy to define it in that way. But I think when we go into these discussions with people that have differing opinions, a lot of the time, it's more about, well, no, chiropractic is a philosophy, or chiropractic is a treatment, meaning specific spinal manipulation to subluxations, right? And I understand where that comes from, but I just look at like what we're able to do in most states in the United States. Like, I get scope is different across different states, but in general, our scope is relatively wide. We have a lot of things available to us to, at least from my opinion, work with people that often have like non-life threatening types of pain, right? That's kind of the area we work in. It's people that, I mean, not to say that people that have more serious conditions can't be helped by chiropractors, because they can a lot of the time. But I would say our wheelhouse is very much people that have non-life threatening pain that doesn't fall in these other categories where we have these severe diagnoses that clearly need to be treated by a different type of practitioner, because there are a lot of people we should not be working with. But then I think this is where it gets confusing, because as chiropractors, do we have to have an allegiance to this idea that we are adjusters simply because of our title? And I think a lot of people would say, yes, like, you're a chiropractor. You adjust people. You primarily adjust the spine. It's what you do. If you're doing anything else, you're doing another profession's work. And people will say this all the time. Well, if you're doing exercise with someone, you're doing physical therapy. It's like, well, I don't think physical therapy owns the rights to exercise. Like, there's lots of professions that could suggest exercise. And the question I always come back with is, well, if any other medical profession performs a spinal manipulation or a joint manipulation, are they doing chiropractic? And a lot of people will say yes. So if a physical therapist does a mobilization to a joint, they are doing chiropractic work. Like, I don't understand that. I don't know why we have to have ownership over specific modalities. To me, like, that's shifting the focus towards us as the professional instead of doing what's best for the patient. If we're providing care that's centered towards the patient, like, why would we not use the things that are at our disposal to best help them, instead of, well, I have this title, so I have to do this. simply because of our 120 plus year history. Like, that doesn't make any sense to me. We have all of these things at our disposal. If we're providing patient-centered care, we should be using the things that we have available to us in the best way that we know how to help our patients, to support our patients. And sure, that will look different for different people, but that's where I get very confused in this. Like, it's not about my title. It's about what I can do to help somebody. And I get that that can be confusing from the public's perspective. And your wife is a great example. Like, oh, you're a chiropractor. This is what you do. But I think that's simply because we've only done it that way for the majority of our profession's existence. And I think that's a part of having these conversations like this, and what we're doing on our podcast and what we're doing for our platform is getting more chiropractors out into the world who are showing people that you can have a different experience working with a chiropractor. And that, yes, there are chiropractors that will only adjust you, and that's fine. But there's also chiropractors that can take you from this point where you have chronic pain and you don't know what to do and you kind of need a complete overhaul in the way that you're approaching it. They can walk you through that process and walk you all the way to the goals that you have. So, as you mentioned, maybe this suggests that we need some type of divide or some type of labeling within the profession so people can differentiate for themselves. Or it's just that we need time to happen, and needs probably a strong word. And we'll see more chiropractors move out into the profession and challenge the way that things have been working for the majority of our profession's existence.
You guys had an interesting discussion. I think it was in your 5th episode where Rich was talking to yet another chiropractor. I can't remember his name.
Strap Polson.
Yeah. Okay, yeah. He and by the way, I don't agree with a lot of what he said, but I think he did a great job of explaining it. So I feel like that was a really good guest. I mean, I give him credit because he stood his ground, and I felt like, to the best of his ability, I understand where he's coming from, I guess. He did such a good job explaining it. But it was an interesting thing because he said something to the effect, and I don't want to take the words out of his mouth, but we have guidelines, and the guidelines tell us what not to do and then what could be part of evidence-based care. So as long as we're not doing things that we're not supposed to do, we can cherry pick, essentially, and this is where I'm paraphrasing him, the things, because he only adjusts people. So adjusting can be part of evidence-based care, but there are a lot of other things that are listed, but he chooses to specialize in the adjustment. And then Rich brought up a really good point. Well, how much can we degrade the guidance? Like, what percentage can we take away and still be evidence-based, truthfully? And I don't know that there's an answer to that, but it's a really good question and it's not something I'd ever really thought about before. And I understand both their points. I think I tend to go more in the direction where Rich is going. Like, there has to be, at some point, if you take away too much stuff and you're just specializing in one type of thing that is a very small part of the guidelines, I don't know that I would consider that to be evidence-based, but I don't know that I can prove that it's not. But it's such an interesting thing because he truly believes that. And now I understand why he believes that. But I don't know, like, is it going to take a governing body like the American Chiropractic Association to come in and say, like, hey, this is what evidence-based means. If you're going to say it, like, you have to fall within these guidelines. You can practice outside the guidelines because it's still within your scope of practice, but you don't get to call yourself evidence-based. And I don't know the answer to it. I think I thought it was a thought-provoking conversation between the two of them. I think they did a good job with it. And I'm really happy they brought that up, because he brought up an interesting point too, because he said something to the effect of he wants to be like, focus on providing a world-class adjustment. And that world-class stuck out to me because I'm a soccer fan. And so we're always talking about world-class players. And it gets thrown around a lot. And a lot of time it'll be like, Cristiano Ronaldo's world class and Messi's world class. And I think we can all agree on that. But really, we'll argue on certain players, professional athletes, because it's like, okay, in their position, within their time when they played, were they the best in that position? Can we really consider them world class? And there's a huge debate on that. So if I take the idea of world class, which again, that that term sticks out in my mind and we apply it to adjusting, what does that even mean? Like, how would you, at least with a pro athlete, you can have stats. You can be like, well, they won this many championships and they played this many minutes, they scored this many goals. So you can start to add a numerical value to it. But if we're going to say that, hey, I am a chiropractor, so I should be using my hands and I should be providing world-class adjustments, and that's my job. What does that even mean? Like, who's to say, like, how do I measure that? How do I know that I'm world-class? Like, is it like the volume of the cavitation? Is it, you know what I mean? Like, I just don't, that would be a follow-on question. As soon as he said that, I was hoping someone would ask him that, because I was like, I need more explanation, because I get that a lot in my state when I talk to other chiropractors. I've had several people say, and they literally use, I don't know if they're like taught to do this at certain schools, but like, don't forget what you went to school for, and they hold up their hands, and it's like, oh man, like I feel bad for you, because you don't have a lot of options as a healthcare provider. You know what I mean? Like you're
You're missing the point.
yeah, you're so limited there, and your patients are so limited. You know, and options are such a good thing for patients and for healthcare providers, where, you know, I can spend all day and never touch a patient and still help them, or I could spend all day adjusting. Like, it just really depends on the day. So I don't know. I thought, if anyone is listening to this and you haven't listened to episode 5 of Chiro Shift, it's a pretty good discussion. I think even for patients, they should be able to follow that, because it shows like the dichotomy and that kind of, I don't know, the different perspectives within the profession. And I think it's relevant to what I wanted to talk to you about today, which is maintenance care, because maintenance chiropractic care from a traditional standpoint is really taking that adjustment, keeping it up on the pedestal, and being like, hey, you're not in pain anymore, but guess what? You need to come in once a month for the rest of your life, because I deliver world-class adjustments. They're just lightning in these hands, and it's going to have health benefits beyond pain management. And I know how you feel about maintenance care. I think anyone listening could probably tell how I feel about it. But the one thing I do want to go over is what provoked this, and this is something we've talked about. There was a video. There's lots of Instagram videos out there, social media videos, and it was a chiropractor up on a stage talking about maintenance care and how good of a thing it was. And like most people who put out these videos, he did a great job. He's a really good public speaker. He's very articulate, very passionate, and very much like, hey, this is something we should be doing, and there is evidence to support this. So we should be talking about the evidence. And he cited a paper, and he kind of put it up there and then didn't really talk about the paper. So I thought, well, I'm game. I can download a paper and read it. So let's do it. And I wanted to look at this paper because maybe I'm missing something. And I read the paper and I just was like, oh, this, again, so disappointing that either he doesn't know how to read research, in which case that's not a good thing, or he does know how to read research and he's just trying to trick people. I don't know which one's worse. I will say, though, that I'm not going to say the name of the chiropractor. I do follow him because he actually he has put out some decent content before. That's the only reason why I followed him. So I don't dislike all of his content. I was just, when I saw it and I read the paper, I was almost disappointed. I was like, oh, I thought he was better than that. And maybe he made a mistake. Maybe he'll take it down. I'm not going to tell him that he made a mistake, but I wanted to go over the paper, get your idea of like, you know, what you think about it, because I know you've read it. And then I want to transition to a conversation of what maintenance care could look like, because you see patients, you release patients from care, and then you obviously have follow-on recommendations that are not show up once a month and get adjusted, but to give people an idea of what that could actually look like. Okay, so we're not going to crack backs for people who aren't in pain, and for everybody, what could that look like? So that's the kind of the direction I want to go with the conversation today. Keep it on more of a positive note and give people like, hey, you always have the option to go get your $35 adjustment once a month, or bill insurance, or whatever you want to do about that. But there are other options out there that chiropractors can provide. So the paper, which is interesting on so many different levels, this came out in Spine in 2011. And I will say, it is technically evidence in support of maintenance care. So to say that maintenance care is evidence, it's not evidence-based would be incorrect, because there is evidence. I just don't think it's very strong. So they only had 60 people in the study, which, if it's a really small sample size. It doesn't make it irrelevant, but immediately when I saw that, I was like, I don't know how he can be so confident with one paper with 60 people. It just seemed kind of small. They had 3 groups. You got one group had 12 sham manipulations, which was actually light pressure, so like a mobilization without a pop, which again is super interesting because it's still manual therapy. It's not really what's used for sham treatment in a lot of things that I've read. The second group got 12 manipulations over a month, so they got their backs cracked. The third group got 12 back cracks over the month, just like the second group. But then for the 9 months after, they got follow-on maintenance care routinely. And they only recruited people with non-specific chronic low back pain. And they said that the group that got the sham manipulations did worse in that first month than the other 2 groups that got their backs cracked. And then the group that got the maintenance care, so they just kept coming in to get adjusted, they outperformed everybody else. Therefore, maintenance care is good. But I was looking at this and it's like, we know that the best predictor of low back pain is a history of low back pain. So you go out and you find 60 people with chronic episodic low back pain. What's the likelihood that they're going to have another episode within 9 months, 10 months? It's pretty high, that a lot of people, so a significant amount of these people, even after their first month of care, are probably going to have an episode of low back pain, but only one group gets to see a provider. So, was it the back cracking, or was it just the fact that they had a support system for almost a year where they could go in regularly and see someone who cared about them and talk to them? So this might be a really good case for maintenance care, but maintenance care in just kind of the form of going and talking to someone and seeing someone and having a support system, which I thought was interesting because no one brings this up. And I've seen this paper cited before, and no one's talking about the fact that, this isn't really strong evidence for back cracking particularly. I don't know if you had any, am I missing something with this?
No, I mean, I think when you look at any paper that's in support of maintenance care, there are almost always several caveats that go along with that recommendation, or as you just mentioned, flaws within the study design. It's one of the two or both. And as you mentioned, okay, it's a study, 60 people, not that many, but you can't have the sham group go 9 months without seeing a practitioner and compare that to a group that gets to see a practitioner. I forget what the frequency was, but over the period of that 9 months, that's not even. You can't compare those two things. And as you mentioned, I think when we start to look at what is the effect of, I think, any modality that we can probably provide, and we'll use spinal manipulation for this one. And we may have discussed this before, but is the modality that we're providing ever being done in isolation? And I think surface level, this sounds like a stupid question, because well, if I only adjusted, it was used in isolation, right? But to me, where I like to go with this conversation is all of the research that points to the importance of contextual factors in care. And for those of you who don't know what that means, it means it's all the other things that go into the environment, that go into how you interpret, for this instance, the visit with your provider. So a really good example would be if you go into a chiropractic office and it's set up well, it's clean, people are friendly to you, it's welcoming, the practitioner takes the time to really clearly explain things to you and ask you questions, and you can tell that they're empathetic and they can tell that they really care about you. and then they deliver an adjustment and you feel good. The adjustment happened after all of these other great things happened within this patient encounter. Whereas if you take the flip side of that, you go into an office that's incredibly dirty and the front desk person is rude to you and the doctor doesn't give you the time of day and they throw you on the table and they pop your back or crack your neck. The likelihood that you have the same outcome in those two situations is incredibly low. It just is. So if you can say that, like if we were to say, okay, well, if the manipulation is the manipulation and you're going to get the result because it's just a good modality, I think you can look at those two instances and clearly see that it's not just about the manipulation. And there was actually a paper that came out recently that talked about like the true effect of the modalities that we tend to use. This was for physiotherapy, but a lot of them cross over into what we can do. And they did their best to measure how much of the treatment effect is actually from the modality provided versus everything else that's happening. So the contextual factors. And what they found for a lot of the modalities was that it's actually I don't want to say relatively small, but it's typically not the majority of the treatment effect. And if it is, it's not like it's a 90 or 95% of the treatment effect. And that actually these other things are often what's providing you with the outcomes of the care. So I think one thing that a lot of chiropractors that only adjust do very, very well is that they provide an explanation that's easily understandable by the patient. They generally exude high levels of empathy, and the patients can really tell that they care about them. And then, as Strat mentioned, we'll use his language here. They provide a world-class adjustment. So that's up for debate what that means. But they provide an adjustment that's probably very comfortable for the patient. We've been in school. We know we've had bad adjustments. Bad adjustment doesn't go very well. If you get a good adjustment, it tends to feel a little bit better. So if you provide this environment and you know that the practitioner cares about you and they provide you with an explanation that you understand, and then they provide an adjustment, which we know on average does create a good treatment effect, you walk out of this visit feeling good, everything makes sense, you go on your way. And then, of course, it makes sense that you want to go back and get treated again. But I want to bring this back to another study, which was really famous for maintenance care. It was the Nordic maintenance study, which I think this was like back in like the early 2010s, somewhere around there. But I actually looked this up before I hopped on here, and they did an update to this back in 2019. And one of the interesting things about this was that they said that they actually do recommend maintenance care, and I'll quote this here. They said that presently maintenance care can be considered an evidence-based method to perform secondary or tertiary prevention in patients with previous episodes of low back pain. So people that have had back pain, you can go to the chiropractor. This is a good idea. But here's the caveat. They recommend it for those who report a good outcome from the initial treatments. However, these results should not be interpreted as an indication for maintenance care on all patients who receive chiropractic treatment. So if you take people that have had a good experience with chiropractic, I'd say the chances that they have a good experience in the future is probably pretty high. But I think we fail to discuss the people that don't get the outcomes from spinal manipulation alone. And then, of course, we just emit them from these studies. It's like, okay, you didn't get a good outcome, so you're not a part of the study anymore. So I think they become very biased in the results. And if you were to ask any chiropractor truthfully that only adjusts, do you get 100% of your patients better? If they ever say yes, they're lying to you. It's just not true. We can never get 100% of patients better. So why do we never talk about the patients that don't get better, and what could the reasons be for that? I think that's a discussion worth having that is just never brought up. We always focus on positive outcomes, which is great. We should celebrate the wins that we have. But to become better as practitioners, we should also be able to discuss the times where we don't get the outcomes that we want, and what could have we done better to help those patients? And was it within our power to help those patients? I think these are very important discussions to have.
Yeah. Yeah. And it's interesting because you don't ever want to like burden a patient with too much, but sometimes there's that desire as a practitioner to be like, I've got to tell you these things. So I wonder, it's just this interesting thing because I feel like probably definitely in my head, but maybe in yours as well. As you're having these conversations with patients, like you want to unload on them and just like give them all this information. And sometimes I feel like I do adjust people. I make sure there's no contraindications, but I'm doing it just to entertain them because that's the expectation, and I'm just, I know I'm providing a placebo. I'm doing my best not to hype it up and misrepresent everything, but sometimes it's just like, I think we can make some ground, and I've got to build some goodwill, and this is the
Yeah.
expectation. And so when people ask how many patients, like how often I adjust people, I would say like at this point, a lot of the times when I do it, I don't know. I've done my due diligence to make sure that I don't feel like there's going to be any harm, but I very rarely feel like it's necessary. Like you can't get better without it.
Right.
And
But
so if you can get better with it and it helps you feel like you're able to adhere to the program more and stick with it and it helps build that doctor patient relationship, I almost use it as just like an olive branch, not as like a treatment in a way. I know this is not how I visualize it in my head. It's not like
yeah.
like this person needs this. It's like, nah, I'm going to do it to build some goodwill so that eventually we can develop this relationship and we can start to make some real changes because I've asked them what they want and I've asked them how important getting this result is to them. And I know that the adjustment won't get them there. But if it gets them started, I think that's probably how I use it the most at this point.
Yeah. That's somewhere I think I've changed my mind on more recently. It was, I definitely went through a phase where I was like, I don't need to adjust anybody. Like, I don't really have to do it because there's so many great options out there for people. And I definitely had that phase in my career where I probably wasn't adjusting more than 10, 15% of the patients I was seeing. I think the shift that I've had more recently is because when we start to line up these different modalities that are available to us as chiropractors, and we can see from an evidence standpoint that none of them are really any better than any other one across an average population for average pain. Let's keep it simple.
Mm-hmm.
We'll keep it there. I think where that gets misinterpreted is that we could use anyone and it's going to work the same for the person in front of us, which is not true because people have their own preferences and they have things that maybe historically have worked better. If someone comes into my office and says, look, I've tried massage, I've tried cupping, I've tried dry needling. None of these things help me the same way that a spinal manipulation does for this middle back pain. Is this something that we could include in our plan of care in support of the other goals that they have? I'm not going to hesitate to give that to them because they've told me what works for them. And I think this is where we get lost far too often, is that if you ask the right questions, your patients will tend to guide you in the direction that care can go. Of course, it's up to us as the clinician and the healthcare provider to steer that conversation sometime and make different recommendations based on what's going on. But a lot of the times, if you ask the right questions, you get the information you need to probably guide that decision making process. So for me, I went from this place of not really adjusting anybody to just asking better questions. And I think that led me to adjusting more people simply because they told me that, look, this helps me. And my goal is to get back to deadlifting or back squatting. And this pain is kind of bothering me today. So before we go do these other things, because people are well aware of the way that I approach care now, which tends to be much more active in nature. That's definitely my bias. But um, if I can understand that this is something that on average will be very helpful for that person, and it's going to take me a few seconds to do this, it's going to build rapport, as you just mentioned, because we're working with them now, not on them. Why not do that? It's, as much as we say it's a tool in the tool belt, and I think we often say that as a means to kind of shy away from care, it also means that sometimes it's probably the right tool to use. So I think that's a perspective that we need to understand, is that as we go down this more evidence-based path, I think the connotation of that has become so Not so. It carries a negative weight in a different way now than I think it did a handful of years ago, because people view it as, well, if you don't have a research paper and you don't have a meta-analysis or a systematic review, you're not going to do anything. It's like our interpretation of the research is to help support decision making. But we still need to understand individuals. We still need to understand who they are, their personal experiences, and take that into account in the way that we approach things. So if someone tells me this is helpful, and as you mentioned before, there's no contraindications to care, and we have a plan in place to do the other things, I'm probably going to do it almost 100% of the time if those are the circumstances.
Yeah. Yeah. I am at the point now where I have recently denied care to people, chiropractic adjustment care, because of contraindications. And I do my best to kind of explain that. Um, and it's usually not, it's met with disappointment, I guess I'll say. But gratitude in a way, because I can just be honest with them. Like, look, if a family member of mine was presenting in the way that you were presenting, I wouldn't adjust them. So I'm giving you the care that I would give to someone I'm related to. And I think if they're not at that point, even if there's disappointment, they're like, okay, that's honest. There's plenty of chiropractors in the area who probably would adjust them. So, I can always connect them there. But usually at that point, when you're honest, they don't want to. Now there's a little bit of a trust there, because I'm willing to let them walk away because I think it might be the best thing for them. So I do think that there's that fine line that we can walk where we're just really honest with people. And then, to your point, meet their expectations to the best of our ability, to the best of what's safe for them, but also not letting them think that something magical is going to happen from anything that we do. Even from the other side, from exercise, as if like I promote exercise and physical activity all the time. And, some people make fun of me for that in jest, but it's one of those things I do have to clarify to people. I'm not saying that if you get stronger, you won't be in pain. Like, that's like, there's no level of strength. And I'm not saying if you can take 12,000 steps that all of a sudden you're not going to have low back pain anymore. But we do know that there are some really, really good benefits to physical activity and exercise. And I think that's where like I put such a large emphasis on other things. It's like, there is no known benefit to spinal manipulation other than some short-term pain relief. That I think that's about it. And it doesn't work for everybody every time. And it could actually increase pain on some people. I think it's safe, but it's very limited what it can do. Now, if you're going to say, well, exercise, like physical activity, has the same potential for pain management, I can buy into that. But physical activity also has second and third order benefits. I mean, if you're looking for like a true panacea, like that's it. You know what I mean? Like improving mood, improving sleep, slowing effects of aging, decreasing risk for heart disease, type 2 diabetes, some kinds of cancer, decreasing your risk for dementia and Alzheimer's. I mean, the list goes on and on, improving your immune system and speeding the recovery, making you more robust, giving you more energy. You know what I mean? Getting fitter, walking more, getting stronger, improving your cardio and your VO2 max and all of these things, it just makes everything better and decreases your risk from death from all causes by well over 50%. If you're looking statistically at population statistics. So yes, if we would have a bias towards physical activity and exercise, you could label me that way, but I can defend it because I can agree that the pain management might be equivalent, but even if it's less effective at pain management than adjusting, it's still a way better way to spend your time because we can actually get healthier doing it. And then on top of that, if I can add in adjustments and it's safe to do for you and you like it, then that's cool too. Like, let's double dip for sure. But I think I'm pretty, I try and meet people where they're at, but I try not to mince words. Like if you're getting adjusted and you're not looking at physical activity, sleep, nutrition, mental health, you're stepping over $100 bills to pick up a penny.
Mm-hmm.
And so yeah, let's keep those things in there, but let's look at the big picture here and look at what we know actually has some benefit for the things that we want. And what
Right.
people, when you ask people what they want, very rarely, like someone will come in and say like, yeah, I want an adjustment. But when I say, no, like really, like why, like what's going on? Like what's the reason behind it? You get some really deep meanings out there, and people want more. And at that point, once they've opened up and they've given me that emotional why, I can't be like, well, L5, L5, S1, C1, and then we're going to make this a magical, I'll give you a magical T4 extra, and we'll just, fix that gallbladder. And it's just like, it just, to me, still feels so icky to practice that way. And I like being honest. Like I being able to be honest with a patient, even if it rubs them the wrong way, which I never try and do, but even if like people are like, I'm disappointed, I thought I was going to get something different, I can still walk away from it happy that I tried. And hopefully they may not like me, but hopefully they trust me,
Yeah.
and would ask me a serious question and respect the answer, because they know above all else that I'm going to tell them the truth, whether they like it or not. So I don't know. It's such a fine line to walk.
It is. And the way that I like to look at this is that I view myself as a healthcare provider. I'd say a lot of chiropractors would say the same thing, right? And if we're truly passionate about being healthcare providers, I think we sometimes have to take a step back from some of these ideas and some of these labels that are placed simply on our title as a professional. So you listed all of the benefits of physical activity and meeting physical activity guidelines, meaning you're doing a certain amount of cardiovascular work per week, you're doing a certain amount of strength training per week, and how much benefit that can carry to a person's overall health. And I think when you look at the idea, we'll bring this back to maintenance care for a second. When you look behind the idea of regular spinal adjustments over the course of a lifetime, most people will say it's not about the pain, right? It's about your overall health. Well, that's debatable. Like I said, we don't have good information that supports the notion that regular spinal adjustments decrease your risk of mortality, barring everything else. How great would that be, though? Like, if, okay, you could just get adjusted once a month and then like it increases your lifespan by an average like 20 years. Like, that'd be great, right? But to me, like, this is like, why do we get to focus on these crappy studies that have 10 participants and poor design, but we'll neglect all of the research that suggests that these other things are so great for us, which there's a plethora of high quality research in that area. So again, like, we don't need research for everything, but we also should not be ignoring the high amount of high quality research that exists, especially in the area of physical activity. So as you mentioned, it's not better for pain. On average, it isn't. But if it's carrying all of these other benefits and we're able to connect with our patients so we can understand their deeper goals, and we can begin to link this idea that, okay, becoming more fit as an individual is going to help you with these goals and help you with longevity, it's easy to see why someone would have a bias in that realm. And I think if you just look at the state of most people's physical health in the world that we're in today, which I think this needs to be a consideration, we know that most people are not meeting physical activity guidelines. And on the other side of this, when you're not doing that, you are drastically increasing the risk for many of these not great things to happen to us. So we had Craig Liebenson on our podcast in one of our first episodes, and he had a quote that I will probably never forget. And this was addressing physical inactivity crisis that we have on our hands. And it was, we are shepherds and stewards for movement, and the world has stopped moving. And I think that really encompasses this idea that as chiropractors, we get to see a lot of the people that are coming into us with pain, but also we have the opportunity to get to know these people and to have them open up to us and share their goals with us, and that we could be the person that gets them to create some of these changes that truly has a long-term effect on their health, because we have the opportunity to spend more time and to converse with them and to understand them as an individual, where not a lot of other healthcare practitioners have that luxury. I think the way that we're set up, we're maybe one of the best professions to step into this role. I'm not saying that's what we need to do or that's what's best for the profession, but I think we have an extreme opportunity to do so, to actually promote health span, which is another term that he likes to use, which it's not just about how long we live. It's not about lifespan. It's about how long are you healthy enough to live the life that you want to? Can we make that health span last your lifespan? And you do that, physical activity is a major component of that. And I think that's why it's so important for us, and that, or at least for me, to impart that in the people that I'm working with. That's why I'm biased in that realm, because we can say with an extreme high level of certainty, of course, nothing is ever 100%, but with an extreme level of certainty that if you get moving and if you develop some strength and put on some muscle mass onto your body, it is likely going to have very good effects for you related to your health throughout the rest of your lifespan. Where when you look at spinal manipulation on a regular basis, okay, so it helps people with pain who have had pain before, but we can't say much more beyond that. Where are those secondary and tertiary effects that you were talking as it relates to exercise? I don't see them. Yes, I know what the argument will be on the other side, and we don't have to get into that, but where is the support for it other than anecdote? And that's not to take away that anecdotal evidence, because it does play a role, but I would think if it was that widespread, we would have some indication that that's the case. So that's another conversation. I get why research is difficult and all these things. I'm already going to bring up the topics of the rebuttal of this, but I would think there would be more indication going down that realm that we were seeing some of those things that, oh, look, all the patients that I had on lifelong care plans, they outlived everyone else in their family, like just stupid stuff like that, right? But I don't know that we even see those things. So why do we have this idea? Because of books that were written, decades ago? Like I just don't understand.
Yeah, I was talking to a patient today, a new patient. She's I post-op ACL, and I was talking to this patient. And I was like, "What do you really want?" And she was telling me, and we just kept going a little bit deeper. And she goes, I want to be able to just do whatever I want to do at the drop of the hat and not have to worry that my knee's going to give out. And I was like, boom. Okay, I got that. I know what that looks like.
Yep.
So we gotta spend some time doing physical fitness stuff and then working on some activities that you want, maybe on the surfaces where you like to do stuff, whatever. But what she told me, what I was thinking was she needs confidence. You know what I mean? Like whatever I do, the verbiage that I use, every time I see her, there's got to be a win. You know what I mean? Or I've got to set up a win for her. And when she has setbacks, which are definitely going to happen, we just have to reframe it, and it's like, okay, well, now we know we won't make this error again, or we won't do this again. And so I felt like, and that was, pretty deep into the conversation. But I think the more and more, the better and better I learn to be at communicating and asking questions and getting deeper, which is, I think, just a valuable tool that we don't really have in chiropractic. Well, not all of us. I guess it depends on the person. But as you can get better, regardless of how good you already are at talking and listening more so than talking and communicating and finding out that deeper reason why, to your point, sometimes they just tell you if you're present enough to hear it. And then there's that light bulb, like, I know what it looks like. I know what you want. You know what I mean? And we're aligned now. And whenever I have that light bulb turn on, never do I think like, yep, L5. You know what I mean? Like I've never been like, oh, this is what that person really needs. Cause no one's ever said that. It's always like, I have a goal and I have a fear. Oh, okay. Well, let's address both of those. And everything around it. And then as new goals and new fears come up, let's just keep looking at those. And so I feel like the concept of maintenance care, if whether you keep adjustments or not, I don't really care, but the concept is actually a good one. And so I don't, when I was kind of wrestling with this idea, I was like, well, I don't really want to downplay the concept of maintenance care, because just like I said in that study, I think the study, even with only at 60 people, kind of showed a good case for like staying connected with a healthcare provider, or at least a network of people. Maybe it's not with me, but a personal trainer who I recommend, or something like that. So I'm curious, because you obviously, you see people, you help them, they reach their goals, and then they leave. And at that point, that's when other chiropractors may start selling maintenance care. But what's your version of maintenance care? I mean, it's got to be, I'm sure it's different for every person, but what's your take on that? Like, how do you connect the dots as you send them back out into the world?
Yeah, that's a good question. I think my view and take is maybe a little bit different. I know I have a similar background to you as far as having a CSCS and being comfortable in more of a training environment. So I think that affords me the luxury to maybe progress some patients further along on the physical fitness side of things than maybe some other practitioners. And that's often where my maintenance care goes to is, okay, maybe the initial phase is more acute type pain on average. And our goal is just to calm it down. Let's just get that pain to chill out a little bit so that we can begin to work down this path towards your goals. And the niche that I've targeted for 10 plus years now has been people that are active and have active goals. So it makes the extension of care very easy because it's okay, well, I have this low back pain and I can't get back to powerlifting, or I can't get on these long hikes in the mountains out here in Colorado. It's too bothersome. Well, a lot of the times it's, maybe it's an overuse issue. Maybe they don't have the foundational strength to do the things that they're trying to do. Maybe it's lifestyle change. But these are all things that we get to address. And it happens through communication, as you just emphasized. And then it happens through oftentimes taking them back into the gym space, which again, a luxury that I have. We have 3,500 square feet of gym space in the building that I work in. Um, to just help them get stronger. And again, this was where my bias comes into play. But for the people that I'm working with, because of the typical goals that they have, a lot of times, from my perspective, it's a capacity issue where they're either doing too much too soon, too much in a small period of time, or they just don't have the foundations to do what they're trying to do. We can help them build that, or we can help them strategize better around that, or give them alternatives outside of what they were doing prior. So a lot of it comes down to almost looking identical to like what a good training plan would look like for anybody. But we place an emphasis on understanding pain, mitigating pain, working around flare ups, into also developing the physical attributes that they need to reach their goals. So to me, it's very much an educational process and an ongoing educational process where we can navigate flare ups because, again, as you also mentioned, that these are typically a normal part of recovery for a lot of people. We get to navigate the flare ups, make them feel more confident in those moments so that they can continue to progress versus getting into those moments, not knowing what to do, potentially becoming fearful, and then regressing to a place where we have a lot more work to do. I think education, being an aspect of communication, is maybe the most important thing that we can do in our position as healthcare providers, especially in the space that we're in, simply because we know that most musculoskeletal conditions that we're working with are probably not life threatening. People need to understand better how to manage those on their own. So I think a vast majority of the maintenance care that I provide is continued education for the patients so that down the road, when they have a flare up and I'm not around or they've moved off into somewhere else, they can navigate a lot of it on their own. To me, that's what healthcare is. It's not people needing to rely on a provider all the time to get better. Yes, there's moments where that's the necessary course of action. I'm not going to take that away. But again, this is talking about the space that we operate in. Most often, it's probably not necessary, absolutely necessary to see a provider. It can be very helpful for you. It can probably allow you to move through that process in a better way. But I think if we've taken the time to educate our patients, oftentimes they probably won't need us. And I think that scares us because we want to be the person that they fall back on when these things happen. But if we are truly, truly passionate about patient centered care, an aspect of that is empowering the patient and giving them the autonomy to navigate these things on their own over a period of time. So if you can impart that on your patient through maintenance care by having continued touch points and educating them and guiding them and supporting them through the challenging times towards their goal, and then we get to release them at the end of the day because they just don't really need us in that moment, I think that's one of the best examples of providing healthcare at the highest level these days, is that they walk away from the experience feeling confident that even if pain comes back, they can probably handle a lot of it on their own. And if they don't know what to do, they have a trusted healthcare practitioner that they can reach back out to support them in that time and to further them down that line. So to me, that's what maintenance care is. It's just essentially an extended opportunity for us to impart our knowledge and really guide them through the process until they get to that point where they feel confident enough to go out on their own.
That reminds me of something Craig said. I don't know if it was on your episode or the time I heard him say before. It's like we have this compulsive desire to be Batman when we should be Alfred instead, and
that's Craig. That's definitely
yeah. we got to let the patient be Batman, and we're just there to play that supporting role. And that visual to me, when he said that the first time I heard him say that, and I think he said it on your podcast too, something to that effect, I was like, oh, that's an analogy that a patient could understand.
Yeah.
I'm not here to be your Batman. I'm here to be Alfred, your Batman. I'm gonna get you, help get you where you want to go. And you said something really interesting that makes me smile inside, because the most important thing is that we educate. And I had this conversation with a previous employer, and I really like the guy. I still do. We don't see eye to eye, and obviously I don't work there anymore. But we were having this talk, and I was like, my sales numbers weren't doing too well, and which is funny to say now. But he was like, he said something about how important something was, and I was like, well, I honestly feel like one of the most important things we can do is educate them, because they can't come here all the time forever, right? And even if they do, even if we get them to come back once a month for the rest of their life, it's still only like a fraction of the week. You know what I mean? Even for those dedicated patients, even if they're coming once a week, if you look at like they're only in the room for like 5 minutes at this place, it's like it's still not very much time. I feel like we should give them something else. And he kind of looked at me and didn't say anything, and I was like, you don't agree? And he was like, no, I don't agree at all. I'm like, oh, okay. Well, at least, good thing we're up front there. And I think that was maybe like a week before we decided that it wouldn't be a good fit for me to keep working there. But I still feel that way, though. I feel like the education piece, I completely agree. It's because you're empowering somebody. I haven't been adjusted in a long time. I don't even know when the last time was. That's not to say I haven't had pain, but I'm in a different place because I get curious about pain. It's like I had a new type of shoulder pain. I usually have right shoulder pain. I had left shoulder pain a couple months ago, and I was like, oh, this is interesting. And it was a little bit different than my right shoulder pain, which I've been dealing with for years. And so I had to work through it a little bit. And I picked up some new tricks just on myself, going through that experience. And it's the same thing with low back pain. But I don't freak out about pain anymore because I have a lot of education. I have been educated on it. So all of that fear doesn't exist. So it's more of just like curiosity and this sense of like, it'll get better as it gets better. I just need to keep doing the things that I know that are going to maintain health and help me maintain the level of activity that I want to do. And because I don't have that distress, it just even really bad pain is not that bad. Like I just don't feel the need to go seek healthcare because I know what it is. And then it's like, could I give that to someone else? Like that's a gift right there.
Yeah.
If you can give someone that level of confidence and that level of knowledge where they don't freak out. Because I always ask people, what are you concerned about? Well, you've told me everything, but like, what are you really worried about? What's your worst case scenario? And that's the first thing I address. So like when we're doing a little verbal report of findings, it's like, well, let me get up front. I don't think you need back surgery. You know what I mean? I don't think anything's broken. Like I just go down the list of like, here's everything you were freaked out about. And I'll even talk about it. Like all these questions you answered no to. So we can rule that out. And if you had this problem, these exam findings would have been excruciatingly painful. You were fine. So like we take away the fear and then start to build knowledge. And I hope to give people the gift that I have of just not freaking out about it and knowing that pain is going to be an inevitable part of my life for a given amount of time, regardless of what I do. But I know that I can do things to help manage it and stay active and keep working towards my long-term goals. And for me, my long-term goals are, I want to, I started having kids late, and I want to know my grandkids. I mean, it's that simple. So I know that regardless of whether or not I've got an episode of low back pain going on, I've got to keep moving. Like I have to keep eating enough fiber and I have to keep drinking enough water and I have to keep trying to get my steps in and I've got to throw in some push-ups if I can manage it. It's just like, I just have to keep moving in that direction, even if it's just one tiny step during that painful episode. Because what happens, and you've probably seen this, is someone will have a painful episode and they'll just fall off a cliff. Like, you know what I mean? They'll stop moving. They'll start eating whatever they want. Like just their diet will change. And then 2 weeks later, they feel bad about themselves and they don't get back to it. There's this, it's just a natural human experience where it's like, well, I'm too far gone. I'll just take another week off. I'll wait. And then a week becomes a month and it becomes 6 months and it becomes a year. And it's like that little painful episode just knocked you out of orbit. And now we've not only have we like, do you still deal with the pain because it's not going like it's probably going to come back at some point, but you're less healthy because no one was guiding you and you didn't have the knowledge. So when you say that your maintenance care is all about education or largely about education and then helping, I mean, I couldn't agree more. I think it's something that I wish when people thought of chiropractic, they thought of education and support and guidance and goal accomplishment, not backcracking. Like I wish we could take that word and change the association of what people think about it. Because I think that would be a game changer.
Yeah. I think you made one really good point there. And it was, well, several good points, but I'm going to highlight one. And it's the gift and the luxury that we have when we experience pain as practitioners, because we experience these things. Spoiler alert for everyone, we also have pain sometimes, but it's our ability to understand how to navigate it and to know when it's something that we potentially should be concerned about. Where for a lot of people, any amount of pain that persists for maybe even a few days is something that they'll potentially begin to worry about because they don't know. They don't have the education that we do. They don't have the understanding of, this is something that's concerning. This is something that you could probably still go work out today and it might bother you a little bit, but it's going to be fine. There's no way to distinguish that for most people. And that's, again, why education is so incredibly important. It's so that people do know, for the most part, how to navigate these things, or they do know when it's time to seek out a provider and get an opinion from a medical professional. Because for both of us, we would probably know immediately, like, oh, this is something that's beyond what I can handle on my own. I need to seek help. But for most of the time, it's, oh, this is something new. I'm going to experiment with this for a couple of weeks and see what I can figure out. But I'm going to go about my daily life mostly the same. And as you mentioned, it doesn't get into that vicious cycle. It doesn't spiral out of control to these areas where it's having a large effect on different parts of our lives. And that's probably one of the major contributors to why chronic low back pain is the number one cause of disability worldwide. It's not because necessarily the pain itself, but it's the pain is limiting you from doing other things, or the fear that's around it is changing your behavior in a way that's probably, I don't want to say it's preventing you from getting better, but it might be contributing to you not getting better at the rate that we would further expect. Chronic low back pain is it's a complex thing. We don't fully understand it, but it's just from what we've studied, the thing that causes more disability than anything else in the entire world. But my opinion on this, and take it for what it's worth, is it's because of these other things that tend to happen with pain, especially when it's been around for a long period of time. As you mentioned, you probably stop exercising or moving as much as you were. Maybe that leads into different eating habits. Maybe this leads into lack of sleep. Maybe this leads into stress because you can't work and now your finances are affected. And there's this vicious cycle of the way things can tend to go when these things persist for long periods of time. So I'm not going to sit here and say that education alone is the answer for everyone to get out of low back pain. But it might be a very important component for a lot of people so that they can begin to make those behavior changes and feel confident in them that they're not going to make them worse, so that they can start to crawl out of that hole. Because for a lot of people, they've dug into a very deep hole, and it's very, very difficult to get out. If every step you take, or every arm reach you get to try and get out of this hole, you're just pulling yourself deeper because you don't know which direction to go. And I think that's why it's so important, not just for us, but every healthcare practitioner, to take the time to try and educate your patients, because most people just associate a diagnosis with, the treatment that they're going to need, but there's no understanding of like what it really means. When we take the time to explain these things and how it might affect them and what their options are and what they can be in control of, that's the empowering part of it. That's what allows people to have the confidence. That's what allows them to move forward in a way that they feel good about things, even when they might take a half step back because maybe the pain returns or it flares up, because they understand the process versus thinking, oh, the pain's back, everything I did was a waste because now I'm back to square one. That's something we have a huge opportunity to do for our patients.
Yeah, and I think, just letting people know that it's the biggest cause of disability worldwide for if they're dealing with low back pain. It's something like 80% of people will have low back pain at some point in their life. There's different stats on that, but a lot of people. So I always just tell people, like, if you meet someone who's never had low back pain, they're weird. That's an odd, you know what I mean?
For
Like
sure.
you're in the norm. And for me to say like, let's prevent it or get rid of it would be salesmanship. It'd be false, because I can never promise that. If it goes away, I don't know if I did it. I don't know if that was going to happen anyway. So from an education standpoint, and this is what helped me, I just acknowledge that it is a part of the human experience and I have to be able to manage it. And then as people with strength and conditioning backgrounds, you look at it as sport performance. Well, if low back pain is the sport and we know it's coming up at some point in the future, how can we best be prepared to take that hit? And for some people, I mean, for most people, it's like, well, you had low back pain and, deadlifting bothered it. Well, we should deadlift. We should find a way, because, in a gym environment or in a clinic, we can control everything. I can control the temperature, the surface, the range of motion, the noise, the reps. I mean, like I have complete control. So if I can't get you to pick up something off the floor without pain, in an environment where I have unlimited control, I can't expect to send you out into the world where you have no control and think that you're just going to spontaneously be able to pick something up without pain. And so if we can't solve that in a perfect environment, but we claim to be evidence-based, like, I don't know. I just don't know how that's like connecting the dots. If that's, because you're just not, it's not truthful. And for a lot of people, I don't know if I'm sure you've experienced this. Like I have low back pain with deadlifting, and I have a barbell in the other room. I set it up. I'm not going to coach you. Just pick it up. Unless you're too scared. or something like that. And then usually they'll pick it up and they'll be like, oh, like, did it hurt? And like, well, not really. And it's like, well, when's the last time you tried to deadlift? Well, it's been like a year. Like, okay, good. We're good. You just did, you know what I mean? Then the light bulb turns on and they go, I'm not saying go do 1,000 of those. You know, maybe we just do that one today, but like, let's just high five, because that's a win, you know, and you're not going to die. Your back's not going to explode, and you might be farther along than what you think. And but then that's the education piece of like, I heard something really interesting. I was on Instagram. It was more about business, but it was basically someone who was mentoring other people saying, I don't really know if anyone's learned anything until they try and put it into action. And I was like, oh, but I think it's really relevant for pain management for what we do, because it's like, well, go deadlift and let's see if what I'm doing is working. Like, put it to the test. And if you're not feeling better, then we need to change something. But the whole process is that education process where they're learning like, oh, okay, so I like Romanian deadlifts better than standard deadlifts, or that's the best way to warm up. Or if I've got to carry wet laundry down the stairs into the basement, maybe like this is a better way to grip the basket for me, or something like that. Like we can get super specific, like bring your laundry basket in. Let's put some towels in it. We'll get them wet. You know what I mean? Like, let's just work on those specific things. And the whole process is, if you were looking at it from the outside and looking through a window, you would think, oh, they're working out. But it's like, no, it's an education process.
Yeah, absolutely.
We are making a hypothesis, and we're testing the hypothesis, and we're seeing what happens on the back end. And then we're waiting a couple of days, and then we're going back and forth. And the whole time we're just participating in this randomized controlled trial type environment where, you know, you're the N of one, but you're the only one that matters at this point as the patient. I don't really care what the statistics say at this point. So it's like, let's just figure this out. And then ideally through that educational process, they have the confidence to go just spontaneously pick something up or do some gardening or whatever they want to be able to do, or travel for long periods of time and not have to be so worried that when they get out of the car, they're going to be crippled. I mean, and not have to worry about that they're going to have back surgery or whatever other things that well-meaning family members or other people tell them, you know, and they get stuck in their head and they get scared about those things. Or some well-meaning provider said, no, it looks like your x-rays, you got bone on bone, or there's bone spurs. And then they're thinking like, oh, is this pain because I've got this pointy thing shredding tissue? Like that's what it feels like. And it's like, the education piece is the only way. But it's not education like people would think is like, oh, so you just get on a marker board and give a lecture. Like, no, the education piece is the movement piece.
Yeah.
You know what I mean? Like, we actually go do the things to the best of our ability that they want to be able to do. And we're right there next to them as Batman is suiting up. You're the Alfred and you're standing there and you're like, okay, have you got everything you need? Are we good? You know, and you help them function check their equipment, and then you send them out into the world, and inevitably they come back a little beat up and they need some more help, and kind of work through that. But hey, it's nice to connect with people who think that way about education. And I told you before, I just like, sometimes talking to other chiropractors, I'm just like, I'm smiling. I'm like, oh yeah, that's great. And in my head, I'm just like, oh damn, like, is this really like, do you really think that? And I don't want to get into those conversations. So I'm just like, okay, well, have a nice day. It was good to see you. And I'm going to go do something else at this point. So I don't know. I agree with you though. I think your concept of maintenance care is what it should be. And for those who love getting adjusted, you could also get your back cracked doing that.
Yeah.
Yeah. Just if you value that when you go in, just ask. You know what I mean? If you're seeing a chiropractor, I'm sure they can do it for you as long as it's safe for you, which probably is, because it's a very safe thing to do. So I don't know. Again, going back to like the stuff I see on social media, sometimes I'm just like, I don't know. I guess I'd probably put up stuff on social media where other people have looked at it. And if I went back, I'd be like, that kind of misrepresents me. So I can't hold people. I try not to be too harsh when I look at stuff, but sometimes you look at it and you're just like, oh, like that was intentional. So Well,
I do have
anything
to.
else? Anything else on
No,
this topic?
not today. Well, I mean,
Yeah.
I do, but I don't
Yeah.
have time for it today. So,
Okay.
but I appreciate you having me on again, and it's always great to talk with you about these things. So it's. I hope this information is helpful for at least one person out there.
You never know. But
Yeah.
I'll be looking forward to some more episodes of your podcast as well. I've enjoyed it so far, so keep going.
Thank you. I appreciate
All
the
right.
support.
All right.